Welcome to the Fatty Acid Forum, sponsored by Virtus Nutrition. Join Dr. Barry Bradford from Kansas State University as he takes a look at the causes and consequences of immunosuppression around calving. Now, here's Dr. Bradford.
So the relatively poor function of the immune system in cows right around the time of calving has become sort of a widely understood concept in the dairy industry, and I'm going to talk a little bit today about the evidence behind that and some of the reasons we think that underlie what we call immunosuppression. So this concept was first developed in the early 1990s when cows were evaluated by isolating cells from the cows and assessing their function essentially in test tubes. And what they found with no sort of treatment of the animals at all is that if you were to track those cows over the course of the 6 or 8 weeks around calving, as cows approached parturition the last 2 or 3 weeks before calving, started to see a steady decline in the function of a variety of cell types. And it really didn't trough until the first couple of weeks after calving when it started to rebound. Okay, so in this case, that represents function of neutrophils, so innate immune cells, but they also found this in other cell types. So lymphocytes, which contribute to the adaptive immune system, also showed some suppression during that transition period. Okay, so this work started to establish the idea that maybe there's something to do with the process of calving or starting lactation or something like that somehow disrupted the normal function of the immune system in these cows. And this is important and relevant because if you just simply look at the incidence of infectious disorders on dairy farms, you would see a graph something like this on essentially any farm on the planet. At least any piece of data I've seen would look similar to this. So in the first 5 weeks or so after calving, we have a much higher risk of infection, and this is specifically for mastitis, but a much higher risk for infection, and especially in that first few days after lactation begins. And we don't really see any other rise in infection risk until at dry off. And there's some obvious reasons for that, dealing with just the gland expanding from not being milked and the risk associated with pathogens potentially getting up the teat canal and being able to sit there without being flushed out every 12 hours. Okay, so this time of immunosuppression is associated with the greatest window of risk for infections, so it's probably very relevant. And recently, there's some substantiation of the claims that these test tube assays actually predict the ability of a cow to fight off an infection. So this is not a large study, but I think the results were relatively surprising. So in this study, they looked at a single marker of immune function. In this case, it was monocyte proliferation in response to endotoxin, or LPS. And so monocytes are the precursors to macrophages, and when you expose them to this endotoxin, they should begin doubling and growing in number so that they can contribute to the troops, if you will, that are there to fight off the pathogen that the body thinks is there because it sees this toxin associated with the pathogen. Okay, so they use this as a metric of how primed the immune system was to respond to an infection. So what they did is they took a group of cows, and at 21 days before expected calving, they ran this assay and grouped cows into those who did a poor job of responding, so relatively little proliferation, those that did a terrific job of responding, where there's lots of proliferation, and then sort of the average group in the middle, where there's a reasonable degree of response. Now, one thing that was pretty interesting here is they didn't necessarily see a dramatic change in the cows that were not very functional 3 weeks before calving. They stayed basically not very functional throughout the transition period. Where they saw the drop-off in immune function to some extent was the best performing group. So they kind of converged towards the average group in the first 2 or 3 weeks after calving. But still, what's really interesting here is categorizing cows by how they responded 3 weeks before calving. Those groupings really did not change until cows were about 4 weeks postpartum. More importantly, though, what they found is with these groupings that were stable, the cows that were the best responders to this single metric of all the complexities of the immune system, ended up having no infectious disorders in this first 5 weeks of this lactation. Those cows in the middle group had, maybe not surprisingly, kind of an average 16% infection rate. But those cows that responded very poorly to this stimulus, 100% of them became infected. And even though this was not a large study by any stretch of the imagination, this massive difference between 0 infections and 100% infections was actually statistically significant. So to me, this gives me a lot more confidence in looking at the data from many studies where we isolate cells from animals and try to assess their function ex vivo, because it's now actually been linked pretty nicely to some in vivo response in a real-world scenario. So the question is, if we believe that there really is immunosuppression in transition cows and that this is contributing to high rates of infections during the first part of lactation, question is, well, what can we do about it? What's causing this problem in the first place? Okay, probably the most depressing answer is the mammary gland really is partially to blame. And the study to demonstrate this actually used cows that were pregnant, and half of the cows went through a mastectomy to have the mammary gland removed. They then gave birth normally, but obviously did not start lactation. So those cows that were mastectomized, if you look at, as an example of an immune function measure, immunoglobulin G in the bloodstream, cows that were mastectomized going from about 3 weeks before calving through 2 to 3 weeks post-calving, really saw no big change in blood IgG. But in the cows that had the mammary gland still, granted they started at a higher level, but you can see the rather dramatic drop in IgG concentrations at hitting a trough really in the first week of lactation before starting to rebound. Okay, so there's some other evidence from this series of studies where they, I think, pretty convincingly demonstrate that lactation is a part of this problem. It's not simply giving birth that leads to all of the immunosuppression. At least part of it is due to the onset of lactation, and it's probably particularly relevant in these extremely high-producing cows. So what exactly is it about lactation that puts the cow at risk or decreases her immune function? There's been some studies in the last couple of years that have helped to clarify components of this, although it's probably very much a mixed bag. In this study, researchers looked at cows that were either able to maintain normal blood calcium through the first few days postpartum, or those that had subclinical hypocalcemia. And this is a very strict guideline for hypocalcemia. This is cows that dip to only below 8.59 milligram per deciliter, which is not a very low drop. And in fact, in the past, we wouldn't have not called these cows necessarily hypocalcemic in any shape or form. And yet, despite having this sort of strict guideline, they found plenty of evidence in this study that cows with this degree of hypocalcemia have weakened immune function. So this is just one example. They again used test tube assay of neutrophil function, in this case oxidative burst, so producing the weapons that are used by neutrophils to kill pathogens. And here they showed that cows that had the hypocalcemia on day 1 and 3 postpartum had significantly decreased function in this respect compared to the cows with better blood calcium levels. And from a very mechanistic standpoint, this makes perfect sense because these cells rely heavily on intracellular calcium stores to stimulate oxidative burst and other things that they do to respond quickly and dramatically to the presence of a pathogen. Another aspect that's getting increased attention now is oxidative stress. So the basis for this concern in a transition cow is that we know that lipid peroxide formation, and lipid peroxides are one form of reactive oxygen species, that formation of these molecules increases in early lactation cows and the liver especially. Okay, and there's a couple reasons for that. One, the liver turns on this process called peroxisomal oxidation to a great extent in early lactation because basically the mitochondria are overwhelmed and peroxisomes produce hydrogen peroxide, which is why they have that name. If you couple that with the massive increase in the amount of fatty acids entering the liver during this time, it really sets up a perfect scenario for the production of lipid peroxides. And this feeds into the other problems we've talked about in terms of immune function, because oxidative stress activates inflammatory responses. And in this case, inflammatory responses that are sort of chronic and not triggered by a pathogen tend to impair immune function and impair responsiveness to a true pathogen challenge. And here's some evidence that this is especially problematic in overweight cows coming into calving. So cows with low, moderate, or high body condition score entering the transition period before calving didn't really show any difference in this marker of lipid peroxide called T-bars in the plasma. But after calving, those cows with the highest body condition score showed a significant increase in this measure of lipid peroxides. And so we think at this point that some of the impaired function in those overweight cows might be due to an increased level of oxidative stress. And there's other ways you can look at this problem as well. So one thing that happens when you get a buildup of reactive oxygen species is that you essentially deplete the body's inherent mechanisms for combating those. And so antioxidants like vitamin E can be sort of used up in an animal that has a lot of reactive oxygen species that need to be neutralized. And there's some evidence now that maybe this problem is helping contribute to actual disorders as opposed to just being a consequence of them. So this is a fairly recent study retrospectively looking at cows that were healthy during the transition period and those that had a left displaced abomasum. And it's not large groups again, but you can see here that even before calving there appears to be some hints that these groups might not be acting the same well before there's any actual problem. And here you can see on day one after calving that the cows that are destined to have an LDA have only about half the vitamin E concentration in blood that the cows that are destined to be healthy. And there may be a few of the cows that were off feed already at that time that might be contributing, but this is generally before the DAs occurred. Okay, and you can see that even after those problems happened, cows that had the LDA and had the lower vitamin E status were not able to recover, at least in the first 2 months of lactation. So I think there's a lot of things that contribute to immunosuppression around calving, and this, you really can't isolate the immune system from the rest of the physiological system that it works with. So just as a handful of examples of things that can contribute to these problems, maybe we'll start out with overconditioned cows that maybe are not consuming adequate energy, maybe partly through diet formulation, but also could be conditions that they're living in, low antioxidant status, either because of the diet or some other potential reasons. Anyway, all of these things contribute to oxidative stress. And we do know that feeds into this process of metabolic inflammation, where we really focus on the liver a lot, but it can impact other organs as well. So acidosis and heat stress certainly can contribute to that as well. The problem with both of those things, in addition to causing metabolic diseases directly, is, as we talked about in a previous presentation, that can lead to depressed immune function. In addition, if you add on potentially hypocalcemia, and there are some now evidence for some direct effects of heat stress on immune function, now we're really setting up a cow to actually experience some infections, especially if there's a high pathogen load. Cows with infections then, or even subclinical conditions, we expect to have decreased feed intake. Okay, and that can also be compounded by, of course, inadequate space at the bunk, crowding, lack of feed availability even for a short period of the day, or just poor diet formulation, essentially contributing to poor palatability. And so then decreased feed intake, of course, contributes to inadequate energy intake and oxidative stress associated with continued mobilization of body fat. And this positive feedback loop sort of continues. So really the take-home point here is anything we can do in these check boxes to sort of decrease the risk for these cows should have ripple effects benefiting the cow in ways that maybe we hadn't expected.